What's going on, everyone? So in this video we are going to have an interview video with Dr. P. Those of you guys who don't know or who haven't seen the other videos, you guys can get it here or in the description. He's the one who I did the research study with, right? And so he's the one he's a DPT professor. He's going for his Ph.D. And he also is the very first professor you will encounter as an incoming first-year DPT student. So I think he would provide so much insight. So get ready, you guys. Take some notes, because when you're a DPT student, or these are the characteristics that is going to be a successful DPT student, you want to write all these down, because this is going to be a fire interview. Let go. What is going on, everyone? Welcome back to the channel. Those of you guys who are new here, my name is Justin Lee, Doctor of Physical Therapy student, almost a Doctor of Physical Therapist. I'm graduating very, very soon. I'm super glad, and these videos are going to be just amazing because I'm going to be making them at a very, very special place. Little spoiler alert. But if you are just paying attention, you guys will soon see. Here on this channel, you'll find videos on fitness, physical therapy, and lifestyle that helps inspire self-change. I truly believe that lifting not only weights, but also each other can help empower greatness and encourage excellence. So, no matter what journey or path you're on, I'm here to lift you up. Change people. That's why we live for change, people. If any of this resonates with you, feel free to subscribe and hit those notifications. Okay, so Dr. Patterson, like I said, he's the very first professor that you are going to encounter as a DPT student. I thought it was an awesome opportunity to just interview him, because he can provide so much insight as to what he sees and in his experience as a professor. What are some things that students have as far as qualities or characteristics, and they perform well, as opposed to students having certain other qualifications or characteristics and then maybe not performing as well or kind of failing off. Because, I mean, failing out of DPT school is a little bit common, so I figured, hey, I might as well ask from the source and just ask the professor a couple questions. So, guys, take out your notes. Here we go. Alrighty, hello everyone. My name is Justin Lee, and I am here with the famous Dr. Patterson, aka Dr. P. Now, we're not going to do any rapping here today. If you guys want to know more about that rapping, watch the video before. But Dr. P is the one who I was talking about in my other video about the low back study and all the research behind that, this guy is the mastermind behind all of that with his team. So this is him himself, and I just want to have this opportunity to sit down with him, talk to him about what PT school is like. He's actually going to be one of the very first professors that, if you go into physical therapy school here at APU, he'll be one of the first professors that you see. So I thought it'd be a great opportunity to kind of pick his brain about what it's like to be a PT student in his class, what are some tips that he might have, and then just learn a little bit about his expertise. So before we get started, I just want to introduce Dr. Patterson, and I'll let him kind of talk about his background, why he's here, and then we'll go on from there.
All right, yeah, good. Thanks for having me, and I'm happy to share any new information that would be helpful for PT students who are in the future coming here to APU or going to any other school for that matter. So yeah, I'm an assistant professor here at APU, and I've been here for I think about 4 or 5 years, maybe 4 years full time. I did some adjunct teaching before that here at APU, and I also taught adjunct at Cal Poly Pomona in their exercise science or kinesis program for about maybe 2 or 3 years before I came here. So my interests are mostly in biomechanics and movement anatomy. I'm doing my Ph.D. right now, as you've seen, in like low back pain, looking at biomechanics of low back pain, MRI imaging, and how that relates to movement. Otherwise, I teach clinical skills here, which is like one of the first classes that the students have. And then I also team teach with Dr. Wong in the ortho. What is that? 3/4 of ortho.
Yeah.
And then radiology or musculoskeletal imaging I also teach online. And I think that's it for now. Yeah.
Could you explain a little bit about what clinical skills is like? What are some like, I guess, keywords or things like
Sure.
biomechanics, range of motion, that kind of stuff?
Yeah. So here at APU, clinical skills is taken at the same time that you're taking anatomy. And the goal of clinical skills is to look at how the anatomy relates to movement and motion. And then we talk a little bit about like very basic pathology so that the students get an idea of it's not just memorizing muscles, it's memorizing or learning the muscles and how they interact with the joints and the bones, and then how that then can lead to some pathology. And I come up from a biomechanics standpoint, so that when we look at a muscle, for example, we know how that muscle functions based on, the direction of pull, where the axis of rotation is, and how far that lever is, so we know like how good is that muscle at doing that certain activity. And so that's what we do. We spend a lot of time doing that in clinical skills, and just talking. Then once the students kind of begin to realize that, then we can talk briefly about pathology. I think that's the interesting part, is like how people have pain and how we put stress on different tissues, that kind of stuff.
Right. Yeah, I remember when I first got into the class, I was like, whoa, this is kind of like what physical therapy actually is, like the science behind it.
Yeah.
And it's really cool because since we do it in conjunction with anatomy, it's like we learn the muscles of the hip, and then now we get into the applicable part. And it's like, oh, these are how the hips actually work.
Yeah.
These are some things why the lever arm is different, and that might cause different stresses and whatnot. So,
and we can spend some time talking too about like exercise and how different exercises, use different muscles. So it's kind of similar to what you take in undergrad, like a biomechanics course, but now it's more in depth, and then we can start talking about like the treatment, very briefly about the treatment of some of those things.
Right. Yeah, super in-depth introductory course to physical therapy. I remember when I first got in, I was like, whoa, this is a lot of information, and I wasn't used to it because I was just used to like kinesiology, like basic, how does a muscle work, actions, origins, and that's it pretty much. But putting it all together was a lot.
Yeah, and that's the fun part, I think, right?
Yeah, it's definitely the fun part, yeah. I remember studying in your class was probably one of my favorite things to do in the very beginning. Anatomy was kind of like, it's just memorized, but this like, oh, this is the cool part.
That's why I enjoy teaching it. It's like the functional part of it.
Right. So that being said, I was just kind of wondering, or a lot of other students are wondering, what are some top characteristics of some students that you had or that you can imagine of being successful in your class? Since it is a lot and there is so much information to understand, could you describe some characteristics, study habits, or things like that students might be useful for?
Sure. So I think the students who are most successful are the students that come in with some kind of background. And it doesn't mean that it can't be overcome, but students who have had a background in at least had biomechanics or physics or have some understanding of those concepts, it's a lot easier to then attach on to that new information. So I think that's the first thing. As far as study habits go, I think the students who are, I'd say students who are open to learning new things. So it's a fine line between having some experience and having some knowledge of biomechanics, and then also not being too like, well, this is how it is, this is how I learned it, and there's no other options. So being open to taking in new information you don't have to necessarily agree, but taking new information and being able to then put that into the old information you've already learned and continue to learn. So I think that's one of the big things that students have to be able to do early on. And then another thing I think study-wise is being able to, it sounds a little bit silly, but just like new concepts, things that just are brand new, being able to take those, learn them in class, and then go and study them, process them, spend time reading, reading the book or reading whatever it is that you want to read that gives you some more information about that. And then we come back to class usually and we talk about it again and we put application. And you just can't let that go. I always say it's a little like math, when you learn step 1 in math, if you don't get step 1 and 2 and 3, then when you get to step 5 or 10, like you're completely lost. So you have to be able to kind of keep up and just do the things along the way. I try to do lots of activities in class where students can explore those concepts, I can answer their questions, because I just don't, if you just keep going and you don't learn the basics, then, year 2 of PT school can be kind of difficult. So.
So it sounds like fundamentals is like super important,
Yeah.
and to really not look over those things, but really spend time investing in
Yeah.
learning those fundamentals. Otherwise, you'll be set up for failure later on.
Yeah,
Kind of thing.
possibly.
Yeah, possibly. I guess how much time would you recommend a student to study? I'm sure everyone learns and studies differently, but if a student's coming in who's undergrad or is about to come into PT school, and it's like, how much time do I really have to put in for this? Because you mentioned about preparing and learning and understanding that. What would you recommend?
Yeah. I think, I don't know, like an hour. I'm not sure I can say a specific amount of time, but I think you have to have enough time I think it would be best if you came to class with already an understanding of what we're discussing. And a lot of times that happens because you have been in anatomy and you've already talked about muscles and joints, so it's not totally new. But then you have to spend, and like you said, everyone's different. I would say a minimum of, I don't know what the ratio is, like 2 or 3 hours per hour we spend in class is probably fair just to get the material. And then I think when you study for a test, there's probably more to it than that. And I think when you study in a group, sometimes that takes longer, but that's also helpful. If you study alone, that might be a little quicker. But yeah, I think it's just, I always tell students, when you think you know it, put your books away, take out a piece of paper and just write it out. And if you can write it out and you can explain it to your partner or yourself without having to look in the book and it makes perfect sense, then you're probably, at that point, you're probably good. So that might take you a couple hours to get there. Some people it takes, 5 or 10 hours to get to that point. But if I'm in undergrad, we all know this, right? Undergrad, you go and test, like, I think I know it well enough. I could get by. I can figure it out, right? Well, it's not going to work. You have to make sure you know it because we're going to ask you questions and your patients are going to ask you questions and it will be obvious if you don't know it pretty quickly.
Yeah, I think it's kind of like that whole concept where it's like if you truly know it, if you can teach it. But if you can't teach it, then, I mean, maybe you really actually don't know the full concept. Fill in the gaps, exactly. So I was wondering, what does it mean to you to be an engaged physical therapy student? Like I'm sure you see so many students in your lifetime. What are some things or some things that students do to like really show you that like they're engaged, they get it, they are successful in my class? What does that look like to you?
Yeah, I think the engaged students are those who are kind of willing to go above and beyond just what we're teaching in class. So there's lots of research projects going on at the university, whether it's APU or some other school. Those students tend to get involved in that. When we are having a con ed course on the weekend and there's some free spots open for students, even though it might be kind of above their skill level, like they show up for that. So the students that are engaged are, like, it sounds simple, but they're here. So they're here when we have a review session. They're here when we, have patients come in for something else, like a special occasion or something. So I think the simple thing is just be around, and you tend to learn a lot more. And then you get to be engaged in different projects, and professors will reach out to you. Hey, do you want to help with this? Do you want to help with that? Because they see you around. Where if you just kind of come and you leave, then it's harder for us to engage with our students. I think APU is pretty good. We have a lot of students who are just around. And so those students are the ones that are involved in everything, right? They're TAing, they're GSAs, they're helping with apps, they're helping with research, and they're learning. I mean, it's helpful for us, of course, and we appreciate that, but then I think the students learn a lot more that way as well.
Yeah, just like when in your research study, I was just put out emails like, hey, yeah, I'm around. I'd love to participate. And just based on that, I'm like, wow, I learned so much about like what's available, like how my body is, like why I have certain dysfunctions. So yeah, I would absolutely agree with you on that one. So in your opinion, what should students do to avoid, like, what are some pitfalls and some bad habits that you've seen that makes students unsuccessful?
Yeah, I think it goes back to what we discussed before, and that's just sort of glossing over some of the basic things. So either assuming that they already know it, which maybe they do, and that's fine. Like, there's certain students you can tell they've had biomechanics, they have a really good background, and the class is not too difficult for them. And so then I try to get them to help other students because that's helpful for students who might be struggling. But the ones that just kind of assume they know it and gloss over the information, don't spend as much time, aren't engaged, as you said, and that could mean maybe they're working outside of school. Some students can do that and they do just fine, but other students, I think they need to change their outside of school schedule, at least maybe the first year or two, to match the time that they need to complete the assignments or the projects.
Right.
I mean, really, you're spending so much money to go to PT school. So one, you should like it, and you should enjoy engaging in it.
Right.
And so if you're finding that it's hard to spend the time on that, on studying or reading, then you kind of have to ask yourself, like, is this something you really want to do? Because it's going to take a lot of time, and if you're not like super pumped about it, then I think it's like could be a drag, you know.
Right.
So I think most of the students, us included, like we really enjoy doing it. So it's not a drag, right?
Mm-hmm.
But if you're just like pulling teeth to study, and of course that happens sometimes, but if you're pulling teeth to study and it's just difficult to give yourself the time to do that, then you either need to adjust your other schedule so that you can do it, or maybe decide if this is really what you want to do. And sometimes we have students who decide like after a quarter, like, oh, this is like more work than I thought. This is not up for me, not for me. So I think answered your question, right?
Yeah,
the question was,
definitely.
What was the question?
Unsuccessful.
Again? Unsuccessful. Yeah, just I think not dedicating the time they need to dedicate to it.
Gotcha.
The students that struggle with like the first or second test, but I can tell they're putting the time in, they'll get it eventually. It's the student that is not doing well in the test, and they're also not engaging and trying to improve. That makes things difficult for them.
Right.
Yeah.
Yeah, I think it's just kind of like in undergrad as well. It's like it's like if you see a student trying, eventually they're gonna get it. They're coming to your office hours, all of that. But like in undergrad, it's like if you just kind of gloss by, you don't get a good grade, you don't go to office hours, you don't even try, then you're gonna get your outcome's gonna be poor.
Yeah.
But in PT school, it's like you're putting in a ton of money.
Yeah.
This is your future, your career. It's not just an undergrad major. So I mean, it's probably pretty important to invest in that time to make sure you are successful.
Yeah.
You mentioned that out of class stuff like habits, lifestyle should match PT school.
Mm-hmm.
What do you mean by that? Like with work, sleep, family, all of that stuff. Like what should outside look like to set you up the best for PT school?
Yeah. So I think the number one thing is we recommend most students don't work, at least for the first year and a half, because it's just such a heavy load that trying to add work on top of that is difficult.
Right.
That being said, I think we realize that some students, like, they need to work, take care of their family. They have a lot of things going on, so I think we try to be sensitive to that kind of thing. But I think outside of school, during that year and a half, I think you being involved with your friends and your family and your church, I think those are all good, healthy things to do to balance your life. But I think you have to just be careful about during that time being involved in too many things.
Right.
And I think I had a mentor one time tell me it's a season of life, right? So I wouldn't recommend the rest of your life being like that, where you're dedicating all your time to like work or whatever it is, right? But during this time, you might have to, make some sacrifices of things that you might enjoy doing, but you can't do during this time. And I'm sure if I were to ask you, there are some things you had to give up to be able to study, and that's your family has to be supportive, I think, of you, your spouse, your boyfriend, girlfriend, significant other, whatever. Like they have to be supportive of the fact that you can't go and do all the things that maybe you used to do for a period of time. And eventually, you have to do that. And I think you also have to pay attention and make sure that you're taking care of your relationships and your family members and not ignoring those responsibilities. So it's a balance between school and life, but that balance never changes, because once you get out of PT school, then you're working long hours, long nights, and you still have to figure out like the work-life balance. So a lot of us as professors are still trying to figure that out. So it's always hard, right? You always are trying to figure out where to devote your time. So that's not an easy answer.
Wow. Yeah, that is what you just said was so valuable, and I just learned so much even from that, and even hearing like, when you are a PT, it's still hard to figure out.
Yeah.
And I
it's
think
probably harder. I mean, even though PT school is a lot of work, you get like these short breaks, where you can sort of devote time to other things. But if you're working in the clinic 5 days a week and you're working till 7 at night, and that's a lot of work. So you have to figure out how to balance out with church or whatever it is you're involved in.
Right, yeah. I mean, I know my wife had like the hardest time. She's like, "Oh, you're in school all the time." Da, da, da. It's like, I know. It's just a sacrifice for a couple years, and thank you, wifey, for if you're watching this. But yeah, I mean, so those of you who are in a relationship or stuff with family or whatever else you're involved with, you're definitely gonna have to make some sacrifices, because in this season, PT school is like your priority. Like you've done all this work to get to here. Why not make that your biggest focus, and then everything else just in this season will kind of have to be on the back burner, and then you can always bring that back after PT school is done. Yeah. Okay, so we mentioned anatomy. Would you recommend brushing up on anatomy prior to coming to class, or brushing up or studying prior to class? Like, I get this question a lot.
Yeah.
Like, what should students do?
Yeah, and we get that question as well. Like people email us before school, like, oh, what should I do to get ready for PT school? I've been accepted. I start in 3 months. And my advice is always do whatever it is you want to do. So if you don't, I don't think you have to brush up in anatomy. Take a vacation, hang out with your family, travel, whatever it is that you really like to do. I think that would be a good time to do that. Relax, read a book, because you're not going to have a lot of time once PT school starts. So there's no need to start now. Our goal is to give you an education while you're here and not necessarily require you to do all this stuff before you come in. Right. So take care of, self-care for whatever, 3 months or
whatever
6 months, whatever you got, and then be ready to go when you get here. Yeah. Energized.
Right. Yeah. I even, if you guys missed that video, I'll put in the description, but I talked about what should you do? Should you study before coming to class? And that's exactly what I said. I said, just go travel, do whatever, have fun. Because when you're in here, you're just going to be working. So you're not going to have as much opportunity to go out and do those things. So you might as well do them now prior to coming in, since you're probably not in school or doing anything anyway. So take advantage of that unique opportunity where you're not doing anything, so that you can go out and do the things that you want to. What was your experience as a physical therapy student? And then how has that changed today? I know it's been a while.
Oh, okay. It's been a while. This hasn't been that long. So when I went to PT school, I went here to APU, and I think getting into PT school was it was competitive back then. I think it's more competitive now. But my PT class we started with 13, and we lost 1, so we ended up with 12. And so now I think this year we're accepting 74 students. So it's changed a lot as far as the access to professors and that kind of thing. And I think it's also changed like with digital technology. Like everything now we have is on apps. Everything's on the iPad, so I think learning is a little easier, and that's allowed us to grow and still provide, the information we need to the students that's easier to do. Now we have online learning, so like I'm in my Ph.D. program. A lot of those courses are online, which we never had that before. So some of that there's good and bad to both of those things. But I think the biggest changes have just been technology, and then the size of the PT classes. But I think PT has evolved. When I went to PT school, it was much more manual based, like there's a lot of manual treatment. Gotcha. We're now here at APU, we do teach manual, but then there's also an emphasis on like the movement, so those two are together. Right. And I think that's changed even in my own clinical practice, more from manual therapist to more like movement retraining, movement evaluation, those kinds of things. Right.
Yeah, so for those of you guys who don't know, for treatment as a physical therapist, we have many different types of ways that we can do that, whether it's manual therapy, therapeutic exercise, even with like movement, like coordinating that and making sure that they move properly, or analyzing movement. And APU does puts a huge emphasis on movement science. And I don't know, those of you guys who are looking into different schools don't really emphasize that as much. So I'm really grateful that APU does a good job at analyzing movement, because even that, just changing the way that someone moves over time and moving correctly can basically help them like forever. And like it's really powerful that I didn't even touch you and we just changed the way you move and you're already better. So that's like when I first learned that was crazy. Let's talk about your PhD a little bit. So you became a DPT, did all that, you worked, and then you decided, I'm gonna go and get a PhD. What was your reason behind that? And let's just talk about that.
Sure. Yeah, so just to back that up a little bit, so I graduated and with DPT, started working in the clinic. I worked in the clinic full time for 7 or 8 years, and I think I really enjoyed educating my patients. And then also the clinic, I worked at a large clinic and I was in charge of educating other therapists. I really enjoyed that part of it. And it also, to be honest, gave me some flexibility in my schedule to do education and also not and be home when we had young kids.
Right.
And so I really enjoyed teaching, I enjoyed students, I enjoyed educating other therapists. And so I got an opportunity to teach at Cal Poly Pomona, just adjunct teaching, some biomechanics courses.
Did that just come onto your plate, or were you
Yeah.
looking for that?
No, I was just like at like a dinner party or something, and I met someone who was looking for someone to teach some courses at Cal Poly, and so I said, oh yeah, I don't know if I can do that, but sure, like give me the book, I'll figure it out, right?
Sure.
So the first couple of years, it actually went well. Someone had come before me, so I kind of had their information,
Nice.
So that was, I really enjoyed something new. I think I like new challenges. Like, so after I've done something for, 5, 6, 7 years, like I want to find something.
Might as well get a PhD.
Yeah, find something new to do, right? So I began teaching, then I came to APU, and what's happening in like academia is we have a lot of DPTs, but they require you to have a PhD. Like most schools require at least half their faculty to have 50% of their faculty PhD.
Right.
And so when they hired me, they strongly encouraged, like, hey, it would be a really good idea to get a PhD because we need more PhDs in the program. We need more PhD people who have clinical experience.
Right.
So that's kind of what drove me to it. And I wanted to be able to, operate in academia with the knowledge and skill base to do what is required and research is required. And like, as you know, in DPT school, we don't get a whole lot of experience like with research. It's kind of a different, it's clinical doctorate, right? So PhD is just a doctorate that allows you to do more research, writing, and that's part of our role here and as faculty. So it just will allow me to do my job with, having the skills and but that being said, like there's still, even I think when you finish your PhD, there's still like a lot to learn about how to implement research in the university and within the DPT program. So.
Right. Would you recommend students going on and pursuing their PhD or any kind of postdoctoral kind of studies, or because you see so many physical therapists out there that have DPT, and then maybe they go on and specialize with like getting their specialization in OCS, NCS, that kind of stuff, but maybe more towards the academia or even towards that side. Like, would you recommend people to continue to educate themselves in that way, or DPT and going to Con Ed courses is just good enough?
Yeah. Well, I think it depends on what they want to do. So if you want to work in a clinic, to me, in my opinion, there's not really any reason to get a PhD if you're going to be clinically based, Right. So the Con Ed courses, the further education, there's plenty of stuff to learn out there, the conferences, those kinds of things, without having to get a PhD. We do have, I think, some students, and we know, like, even if you look in your class, there's certain students who are like sort of prone to, they're interested in research, they'd probably be very good at it.
Right.
So if they are interested in it, I would encourage those people to do that. Like if you want to teach and you see yourself more in academia than you do in the clinic, then by all means, I think you should do the PhD. I think it's also good though, even if you want to go into teaching eventually, is to spend quite a bit of time in the clinic. If you can get 10, 15 years in the clinic, so that you can take that experience with you into teaching. And I'm in the clinic still 1 day a week because I just think it's important to stay attached and in the clinic so that I'm at least practicing, seeing the changes and clinical practice, and I can bring those experiences to the students.
Right. That's well said. As physical therapists, it's in our code of ethics, I believe, to continue with like pro bono work and then volunteer our time to help the community outreach, that kind of stuff. Yeah. What do you do in your practice to fulfill your, I guess, community outreach? Not even just to check boxes, but if that's something that you love to do, what are you involved with?
Yeah. So I do really like to give back, and it is kind of hard as a physical therapist. When I first came out, it's hard to find things where you can give back or kind of volunteer as a PT. I'm not sure if you've had that experience, but I remember our church was they're like a medical mission or something. They never list PT, just because PT is when it gets down to the basics of what people need, PT is not always something that's thought of as something that's really necessary. Although there is cases where that's true, and students going to Africa and stuff, they've figured out this is a place where they can definitely serve.
Right.
So anyway, I was frustrated not being able to find something to do. So One of my friends started a running group, and they teach homeless people who are living in a shelter to run a half marathon. And they were having a problem with injuries and people not being able to make it to the end. And so he contacted me, and I started helping them with so basically I'm helping the runners with injuries, prevention of injuries, just kind of a little bit of coaching, with training them to run a half marathon. It's like a 13-week program. They're living at the Orange County Rescue Mission or Long Beach Rescue Mission. Wow. So I volunteer with that, and then I also bring students in to help on certain days. We go down, and at the when they run the actual half marathon, Long Beach half marathon, we go there, we give massage, stretch for the runners who are part of our program. Right. So I've been involved in that probably for 3-4 years maybe. And that we do that a couple times a year, and that's been a really good opportunity I feel like I give back. They're very appreciative. Really, they're appreciative of the PT, but more they're just appreciative that there's someone there who has knowledge of running, and they're they think it's kind of cool that someone's there to answer their questions. And it's more, I think, about, in that case, it's about the relationship and just being there. So again, that's it. Just be there, right? I mean, you asked about how students are engaged. Just hanging out with them, talking to them, answering their questions, and really, it's just hey, they want to know: should I keep running? Am I gonna injure something major here, or should I stop? It's a safety thing, mostly what we're doing, but it's also just a people relationship thing.
Right. Yeah, even going off of the volunteering thing, here at APU, we got so many opportunities to volunteer our time in so many places, dancers, runners, different kinds of populations. And just in my experience, I've learned so much from that time of just volunteering. Yeah. I'm not even doing anything. Sometimes I'm actually doing work, like physical therapy work, but even just watching, observing, and being with different types of people and how they move and all that stuff. I'm volunteering, but I'm also learning because I get introduced to a whole new special population that I never would have thought I would ever encounter. Yeah. So it's really awesome.
Yeah, I think too that we I don't know, I kind of view our degree or our ability to go to PT school as sort of, it's an opportunity, as kind of I think it's a privilege. I think you've heard me say in C Skills, we're lucky to be able to spend three years here going to school. A lot of people would do anything to be able to do that. Right. And so I think that we have somewhat of an obligation, I think, to give back and to spend time with people who can use our help. Yeah. Because we've been given something pretty valuable, and I think where we are, and we're lucky to be able to do that. So I think it's the very least we can do is to try to find opportunities to give back and use our skills for people who can use them.
You're gonna make me cry. All right, our final question here, kind of a controversial possibly question here. As physical therapists, we're all about movement. And we want to analyze and change things and make things perfect, right? That's our thing. No, move it a little bit there, and then you're good. So what's your thoughts on what perfect form should be like? Because in the clinic we try to get someone to move as perfect as possible. But as you know, in real life, we can't be neutral spine and picking things up all the time. But then that's what we preach, oh, keep your spine neutral, don't put so much stress on here. So where do you stand on that?
Yeah. Well, I think that perfect is kind of, you're right, it's kind of a term that's not really helpful because everyone moves differently. We know that. So I think there's kind of an ideal. We know gait, right? There's a gait book and there's numbers, and this is the ideal gait pattern. Right. But if we went out in the quad right now and watched 100 people walk, most of those people would not walk ideally. Right. And a lot of them wouldn't have pain. So there's a lot of adaptations I think our body makes, especially as you get older, to be able to walk, maybe not, or move, not in the ideal way, but still be able to move in a way that doesn't load the tissues to a point where you have pain. Right. So I just think of it from a science point, certain people walk less than ideal and they load tissues, but maybe that tissue has adapted and that tissue is just fine being loaded the way it is. I think as therapists, what we do is we see people who are loading a tissue where now that tissue is stressed and it's painful, and we're trying to get them to move in such a way that unloads that stress. It might not be perfect, but at least it's enough to unload the tissue and decrease the pain. I think also, like this other theory that I have is that it's also possible that when we change movement, or we attempt to change movement, the patient might not go back to moving 100%. They may never like regain perfect or ideal movement, but we may have them move enough close to ideal that it takes some of the pressure off of the tissue. So yeah, I mean, you see all kinds of crazy things, like people walking, running. Like, you know, I go to the Long Beach Marathon and you watch people run by. You know, what is that? 7,000 people run by. Yeah. And a lot of times you have like no clue how they're running 13 miles. They do it, feels fine, no pain. You can't really explain that. Yeah. So I mean, I don't really worry too much about it. I just think if someone comes to me and they're running or walking and it's not ideal, I know, okay, well that does load the tissue. Let's try to offload the tissue and see if that's helpful.
You are an educator. you love to teach. Yeah. Like right there, I think I might just record that section, repeat it 100 times, and then when patients ask me, I'll be like, all right, just regurgitate exactly what you said. That was perfectly said.
Don't think at all.
Just do it. All right, last question I'd like to ask this to everybody. What is your favorite exercise or your favorite lifting exercise and why?
My favorite exercise, like for me to do or for
you to do,
patients to do?
Well, I guess both. Like for you, and then in the physical therapy world as a clinician.
Oh yeah, I think my favorite exercise can just be like a general exercise,
anything,
like
Squat,
biking.
Bike, whatever.
Yeah, so I think I most enjoy like bicycling because you can get outside. Like my back is not great, so like running doesn't really work anymore. But riding the bike, I like to be outdoors. There's lots of trails by our house. Now when my kids are getting old enough, I can ride a bike with them.
Nice.
So I don't do anything like major, but like just trail riding, and that's what I enjoy.
Like
probably
mountain
the most.
bike?
Yeah, mountain biking.
Okay.
Nothing crazy, but yeah, just mountain biking outdoors.
Okay. Nice.
And then patience. I don't really know if I have like a favorite exercise for patients. I think the one that I found, as silly as it might sound, that works really well is, you know, like the foam roll extension exercise.
Yeah.
I mean, we do that in the clinic ourselves all the time. We have our patients do it all the time.
It just feels good.
It just feels good. Yeah. I mean, we're all like hunched over all the time. So for whatever reason, we just we give the exercise a lot. I think patients are most of the time like, oh yeah, I feel a lot better just doing that every day. Keep foam roll in my office. Right. And that's what I do.
Yeah. I mean, it's just, they have like ankle pain. You say, all right, just foam roll the back and you'll be good. Exactly. Like, oh, I feel so much better.
You do a quadruped rock back.
Quadruped rock back. Glute exercise.
And that one.
That's your golden 3, you guys. That's it. And then every patient will get better from that point. All right, before we end, I do have a little gift for you, just for a little thank you for being here. I just wanted to say thank you. It's one of my T-shirts, the Lift for Change T-shirt. So I just want to say I appreciate your time, and I know a lot of students who are watching this right now really appreciate everything that you said, and it brought me so much value, and I know it brought so many more students across the world so much value. So we just want to thank you, and thank you for being here and for this opportunity.
Yeah, thank you.
Thank you.
All right.
Wow. I don't even know what to say. I don't even know what to say. Man, hey, a little thumbs up if you feel like he dropped some fire and you just got so much value from that interview. Dr. Patterson, Dr. P, I'll put some of his descriptions and his info. You can feel free to email him, and then he may or may not answer, or call him, but you can find him on the APU website, but I also put in the description as well. Guys, if you felt that you really felt inspired to do something after watching this video, maybe it was you got inspired to study a little bit harder or study a certain way and have a certain mindset, give this video a thumbs up, and if this really hit you, feel free to share it with somebody else so they can feel felt too. You know what I'm saying? Alright, y'all, make sure you also watch all my other playlists. I do have a lot of different playlists, and you'll find them here and here, which can be the DPT vlogs, which is going to come to an end pretty soon, and also the pre-physical therapy playlist. Take advantage of the descriptions as well, because I'm always filling those things with important information, and in 2020, things are going to be big. Alright? Anyway, thank you for joining in. I'm so blessed to have all of you. I mean, I just made 2,000 subscribers and it's like, it's boom, boom, boom. And I think in 2020, it's gonna go whoosh. And I have huge plans and I'm so excited. Anyway, guys, thank you for watching. Change people, change people. That's why we live for change people. Stay lifting. Have a great one, you guys.